Hi, thank you. Can you hear me okay?
Yes, we can. Go
Awesome.
ahead. Thank you.
Thank you. It's been such a pleasure getting to know FaceBase and the PIs and some of the community. Uh, for, I don't know, I've been at NIH for probably about 8 or 9 years. And one of the first talks that we did in one of our BISTE internal science seminars was on FaceBase. And I've really enjoyed watching the evolution of FaceBase over these years. And as you know, I'm a big supporter. What I love about the Dental and Cranial Facial Research Institute and FaceBase in particular is just the innovation that continues to happen. And this IC is a wonderful partner for me because the IC embraces data science and continues to innovate in this space. And I'm just very pleased to partner. And I really want to thank Jennifer and all of my friends at NIDCR for inviting me here and for the continued partnership. And I'm also really pleased to work with the Deafness and Communicative Disorders Institute now as we think about new activities for FaceBase. So with that, I am going to turn to my next slide. Just an FYI, if you don't know my office, we sit in the office of the director in Deep Poughkeepsie for strategic planning and coordination activities, and all the many, maybe now 18 or 19 offices in Deep Poughkeepsie have a goal that surrounds coordination, collaboration, and strategic planning across the NIH 27 institutes, centers, and offices. And mine focuses on data science. So you can learn more about our office and the work that we do. We work with all of our 27 institute centers and offices in different ways to support data science and artificial intelligence and other activities. Jennifer did a wonderful job laying out the strategic plan for data science. I'm really going to focus mostly on the first goal, which is sustaining our ability to manage and share data effectively within the community, both open data as well as controlled access data, for which FaceBase is a lead in that sense. But of course, you can ask me questions about any of our goals and our work that we're doing to support those goals. So, understanding data management and sharing is digging deep into the value chain of data sharing, and I'm sure that Dr. Berman will talk a lot about this. We work on each of these areas, creating data. Thinking about standards, and FaceBase certainly is really innovative in the way that you work with metadata with your community. This is something that I've been really impressed with. It's more of a meet me in the middle type of approach, which seems very appropriate for this community. Thinking about data transformations, mapping to common data elements, data curation, QA, QC. I spend an awful lot of time on this in the health sector, especially when we're thinking about taking raw data from the electronic health systems and then providing that data to researchers in one of many formats. It could be all of us, it could be the National Clinical Cohort Collaborative or other activities. But really where it gets important is the area of management and return on investment. We're taking that raw data from images, from electronic healthcare records, and what we want to do is add value, integrate information and other important data access and discovery for researchers, and then finally impact. And this is not something that I will talk about today, but I'm listening to you because what you're going to tell me is the impact of FaceBase and getting that in our hands so that we can communicate to our stakeholders is really, really important. We at ODSS lead a number of activities in this space, and I'm not going to talk about all of them. I'm just showing them to you so that you can see some of the activities that we do, but I will focus mostly on our support for data repositories and knowledge bases and what that looks like for the community. And I just want to note that you may find this interesting. NIH supports through my office a membership to DataCite. It's a consortium membership, meaning that any institute can support their repositories and knowledge bases or their programs to mint digital object identifiers that are then cataloged and utilized within the DataCite framework and fabric. So this is just something that we've been pushing out through the community. If you find it interesting, PIDs will become more and more important as new policies roll out in the support of some of the administration's priorities. So We're always really keen to support fair, findable, accessible, interoperable, reusable data and activities. And there's a lot of things that we can do. There are more that are planned to make it easier to share data, to find and discover that data wherever that data lives in a repository such as FaceBase or in a generalist repository. That is really keen, and you'll see work at NLM and other activities that are really supporting the search and discoverability of data. I was so happy to see Jennifer talk about the secondary reuse of data and all of the support through funding activities for that. This is something that across NIH we've been talking about a lot. How can we support the secondary reuse of data? You've seen this now in the Autism Data Science Initiative. You'll see it in other areas. And really, reproducibility is that secondary analysis. So super important that your work will do in this sense. And then, of course, Core Trust Seal, promoting public trust in our data resources and sustaining our research software community. We have 2 funding announcements on the street to really sustain software development as well as data repositories. So some of the things we're doing to enhance our data repository knowledge base landscape include, of course, the desirable characteristics for data repositories, but also our funding announcements. And we have a number of funding announcements. You'll see this one listed here. There's actually 2 of them to support activities like FaceBase. And in fact, this is how we support FaceBase and other repositories. We also have another program such as the Gray Repository Initiative to really knit those generalist repositories together to provide activities above the value chain like shared metadata, search and discovery across generalist repositories, metrics that show impact and ROI, as well as an enormous amount of training materials for the community. So I want to put in a plug for our data repository knowledge base program that supports our data management sharing policy. We anticipate that these repositories are filling a scientific need or gap, as FaceBase certainly does, that you're adopting good management practices, that you're enhancing your research community to use and reuse data. This could also include collaborations with journals that are appropriate to your community, and that you're governing the data according to life cycle and preservation. And I see through the actions that you're doing that this is absolutely happening. You'll see on my right-hand side of this slide a number of repositories that we're funding. For example, Redfly, Uniprot, Farm, GKB, Wormbase. We fund a lot of research model organism repositories and FaceBase. Some of these are highlighted in red, and I'm doing this so that I can point out another program, which is the Global Biodata Coalition's Core Biomedical Data Repositories. And this is a program that is not funding, but it's sort of an international program that allows people like you, PIs and communities like you, to nominate your repository to go through a peer review to be designated as a core repository. It's sort of like a badge of honor type of activity. We use that at NIH in one of our many ways to show importance and impact of our repository. So I just want to draw your attention to it, and so that you can see that a number of our repositories have gone through the Core Biodata Coalition's review. Here's a summary of the awards we made in our data repository and data repository knowledge base landscape. We've had many receipt dates and many applications, and so far we've funded 40 competing awards to date. Many are in the knowledge base sector, a little less in the repository sector. We're now moving to fund established and early stage repositories, making that distinguishing factor between those 2 different ways of the life cycle of supporting repositories. Each of these funding announcements has their own standing study section with their own review criteria, and the reviewers are actually people in the repository and knowledge base community. They themselves have been awarded these awards, or they are in other sectors that support data management, data curation. You can see funding by the institutes, centers, and offices here on this slide, and you'll see that many of our institute, center, and offices fund at least one database or knowledge base. But what's really pleasing for me is that many of our ICs are partnering together to fund at least one data repository knowledge base, including FaceBase. And so this is really important. It shows that we are collaborating with each other to really support our data resource community. And we understand that when you are developing a resource like FaceBase, the impact isn't just in dental and craniofacial research. It's in other areas, cancer, for example, aging. There's many opportunities here to think about the impact across the institute, centers, and offices. So I just want to point out, and this slide might be slightly out of date, that you've been doing amazing work, and as Jennifer noted, you have received Core Trust Seal, which is no small thing. I think that's almost 2 years to get this approval. So congratulations. It's a really big deal. But for me, some of the other important activities are the partnership with the National Temple Bone Registry and the work that we're doing to stitch together all of our controlled access data repositories so that researchers can log in once through a credentialing system called Researcher Auth Services, and then get access to data across our landscape of controlled access data repositories. There are 83, I believe, controlled access data repositories, and we're aligning everybody on the cybersecurity requirements for identity and access management and making it very easy for researchers to log in once and access many times. And with that, I just want to leave you with a very simple view of where we really want to make an impact to make sure that researchers can deposit and share their data in community repositories. If there are no community repositories, we have a great initiative program for you to deposit your data. We want to make sure that people can easily access the data, find the data through metadata, and of course, do analysis on any platform that is of interest to you and is important for your research. And with that, I am going to thank you very much for your time. It's been a joy to watch you grow, and I look forward to the talks today.